This is Kardec Radio bringing you the talk, the dynamics of our sixth sense, psychic and mediumistic phenomena in the light of Spiritism, given by Divaldo P. Franco, Brazilian medium and speaker. This partial audio recording will cover Chapter 9, A Mediumship as a Therapeutic Tool. Enjoy. Nowadays, mediumship in Brazil has reached a very relevant moment because of its therapeutic character in the area of emotional and mental problems. Allan Kardec established that not all mental problems are illnesses. Many patients that have been diagnosed as psychopaths are obsessed or influenced by spirits the same way I was. I had a physical obsession. The most common are the mental spiritual obsessions. According to the book Noonday Demon, an Atlas of Depression, published by Andrew Solomon, the journalist, the greatest psychological problem nowadays is bipolar depression disorder. In the world, there are 200 million people suffering from depression. In the United States, 25% of the population will develop depression in the next 10 years. That is alarming. Medical science defines depression from a physiological, psychological, and sociological view. It states the role of hereditary factor on depression. Spiritism comes and collaborates with science by showing that many people who are labeled depressed, or schizophrenics, or autistics are in fact obsessed. We live at a time when we see this great exchange between these two worlds, the spiritual and the material planes. The spirits to whom we do harm come back to collect the debts that we have with them. Through telepathy, they begin by giving us depressive thoughts. We begin to have these singular ideas. Then we begin to dialogue. After that, we become introverted, and then we fall into depression. Medications do help, and they should be used. But the bioenergetic therapy, which is also known as passes in the spiritist centers, should be used as well. In Brazil, we have a therapeutic approach that is set forth in the book Getting to the Light, Spiritist Therapy for Discarnate Spirits by Nilson de Souza Pereira. In using this therapeutic approach, we speak, talk, and educate the spirits who obsess people. The obsessed patient does not need to be present. If the patient has merit, the spirits will bring this obsessing spirit to the spiritist meeting. That spirit who is obsessing will speak through a medium in trance. At that moment, the medium will present the personality of the obsessing spirit, and the dialogue begins. The counselor of the session is like a spirit psychotherapist. The spirit explains the reason why he is going after this person. The therapist dialogues with him until he is able to convince the spirit of the bad things that he is causing or doing. After he is convinced, he abandons the patient, who then is able to recover. In the United States, this experiment was very well developed by Dr. Carl Wicklin, a psychiatrist who wrote a great book in the 1920s, 30 Years Among the Dead. He tells that in his office, his patients or his wife, a psychic herself, would go into a trance and he would talk to the spirit. The patient would then become well. So we conduct these activities which we call disobsession or spirit therapy. However, it is very important that the patient contribute to the therapy by changing his mental and moral attitudes. We can see this in Jesus' gospel when he talked with the demons and cast them away. He said that we could do everything he did if we wished. Since we want, we are able to do it. These therapies to get rid of these mental anguishes are very valuable nowadays. In Brazil, many psychiatric hospitals with spiritual and mediumistic therapy were built. We have over 50 psychiatric hospitals where you will find contemporary treatments and mediumship treatments, opening fascinating horizons. I usually see many people who come to receive treatment. Whenever possible, I have the opportunity to speak to them on a one-on-one basis. The great number of people who carry behavioral disturbances is usually obsessed or influenced by disturbing spirits. It is great to be able to work in this area and to acquire a certain degree of respect from these bad spirits. We cannot ignore the power, the force that these spirits have. They carry on by practicing wrongdoing. I'm going to tell you one of the experiences that I have had. Once, after I had given a lecture, a line formed in front of me so that I could attend to the public. A young man approached and said, "Divaldo, I have a great conflict. I am heterosexual. I am married and I am the father of 2 children. But sometimes I become tormented. Since I am the manager of a bank, I hold a certain social position. So in the country club that I go to, I look for a sex partner, somebody that is at my social level. This has been happening for 30 years. At the time that it started, homosexuality was viewed with even greater intolerance than it is today." He continued, "This anguish happens in such way that my personality changes. When I don't find somebody at my social level, I go to the streets and I pay whomever I find. When the crisis is over, I hate myself. I go home and I lie on the floor, I take a shower, I put alcohol all over my body, and I hate myself. During a 2 or 3 week period, I am perfectly normal. Then all of a sudden it happens again. I am thinking of killing myself." To be continued in Chapter 9b.